This morning we're talking about women who are able to be one step closer to walking into a pharmacy to buy birth control without a prescription. I know, Haley, this is a fluid situation. This is something that you're following very closely. Some advisors are saying there are concerns about how this potentially could be consumed.
Well, I mean, I guess the advisors did in a way say that. The advisors to the Food and Drug Administration is who we're talking about, but they did vote unanimously in support of this drug. It's called Opill. That's the birth control that you'll be able to get without a prescription, and they think that people should be able to use Opill safely and effectively without help from their doctor. So joining me today is Dr. Tomas Rios from Rios Healthcare Associates. So Dr. Rios, jumping off from there, when the advisors went in circles about whether or not people could safely take this without a doctor, what do you have to say to people? What should doctors or what should patients know about how to safely take birth control?
Well, thanks for having me on. So I think that, you have to look at the contraindications for the use of any type of oral contraceptive. In this case, they're talking about progesterone only contraceptive and the norgestrel 75 micrograms that they're saying they approved, but you can't use it in everybody, and that's, you have to look at people who, for instance, have known or suspected breast cancer, other forms of liver dysfunction or cancer of the liver, cirrhosis, other things like that they have to be, careful with. So I think that the benefit I think they saw was outweighed the risk of being able to make it available over the counter. I would say that at least have a conversation with your clinician about the safety and use of it, as with any other medication you might buy over the counter, to make sure that you're doing the right thing.
I think one risk that a lot of women are very familiar with is blood clots. What should people know about the risk of blood clots when using birth control?
So the risk of blood clots is something that, obviously should be taken very seriously. In general, we usually advise that patients should not have a heightened concern unless they've got cardiovascular risk factors to start. And the other thing with this progesterone-only contraceptive, it has been thought that the estrogen component of contraceptives is what increases the risk for blood clotting. So you have a relatively lower risk with the progesterone only. With that said, if you've got hypertension, if you've got diabetes, if you have a history of cardiovascular risk, or if you're a smoker, those might be relative contraindications to starting oral contraception.
And speaking kind of along those lines, women with a higher BMI or a higher weight, is it true that birth control also loses efficacy among those women?
So not really. There's been studies that have shown that the pharmacokinetics in women who are obese versus non-obese are a little bit different. However, in clinical studies that have looked at the overall efficacy, they have not demonstrated a significant difference. So the current recommendations are basically the same as for non-obese women, is the same dosing strategy and everything.
Typically, the FDA does follow whatever the panelists advise or whatever the advisors recommend. It doesn't have to, but typically that's just the historical pattern that they take. So if they do follow this recommendation, when could we expect to see over-the-counter birth control on the shelves?
What I've read is that this is expected sometime during the summer, and I don't think there's any reason to believe that they would go against the recommendation. So if I were the manufacturer, I'd probably be ready to put it on shelves the day they approve it.
That's true. Dr. Rios, is there anything else that you want people to know about birth control? Or, if you as a physician are not going to be having that conversation with your patient, would you then recommend that they have conversations with their pharmacist before taking something like this?
Absolutely, yeah. I mean, of course, the vetting of medications to make sure that the vast majority of people are going to be safe using them is quite extensive. And so I think that talking with a pharmacist about what certain precautions they should take is very beneficial. But, I would always encourage them if they have any additional concerns or doubts about it, to seek out counseling of their physician. But overall, I think it's a tremendous step forward for women's healthcare.
Oh, good to hear. Thank you, Dr. Tomas Rios from Rios Healthcare. We appreciate you joining us live this morning.
Thank you.
Zach, I'll throw it back to you.
A lot of good information. Haley, thank you.